A recent article by The Atlantic says the end of the coronavirus pandemic is on the horizon, but don't expect the change to be quick. And that's because this spring will not be much different from last year's, but they say the summer could be close to normal. So as many of us begin to reschedule those canceled plans from 2020, what are the things we need to know to have a successful and a safe trip? Well, joining me now with more is board-certified integrative medicine physician and wellness expert, Dr. Taz, and travel expert, Troy Petenbrink. Good morning to you both.
Good morning, Marissa.
Well, Dr. Taz, the CDC, of course, is recommending not to travel, but with the vaccines, people are feeling more confident. COVID cases are down in some areas. So for those who have made up their minds, they want to travel starting now, how can they do that and do that safely?
Well, I think there are a number of things they can do, and I understand why people feel that way. You know, we're coming out of a tough winter. Seasonal affective disorder is real, where people and children are experiencing a lot of depression. I think some of the things you can do, driving instead of flying, is a safer way to travel this spring break. I also think picking spots that are more secluded. So, for example, maybe renting a beach home rather than staying in a hotel, or camping, or finding places that are not as crowded will lower your risk for sure. I think in addition to that, observing the precautions we've been talking about throughout the entire pandemic, good hand hygiene, wearing masks, maybe if you are flying, thinking about wearing 2 masks, and of course, you know, observing social distancing rules of the 6 feet and taking good care of your immune system.
Yes, and certainly also with the testing. I know many people are looking at that both before and after, correct?
Definitely, and I think it's important for everybody to remember, like for international destinations, you're testing going in and you have to test coming back out. So that's something to be aware of.
And Troy, we know when it comes to travel, it's hard enough, right? Challenging making all of those plans, and this certainly complicates it even more. What are your recommendations?
Well, I think that one of the key things I would recommend is consider using a travel advisor. One of the things, and Dr. Taz mentioned this, the issues around testing are getting very complicated and they're changing daily. So a travel advisor is going to be able to tell you where you can get tested at the destination you're visiting and help make those arrangements, because that is very important now. If you're traveling internationally, you must be tested before you're allowed to enter back into the United States. I do know that some of the things that are happening, like at Reagan National Airport and at Dulles soon, you're actually going to be able to get tested before you fly, because that's also a requirement for many destinations you're visiting, especially like in the Caribbean. You must be tested before you arrive. So now you're going to be tested before you arrive and before you come back. So you have to be aware of all those rules.
And when you have to monitor those vaccines testing and quarantine requirements, depending on where you go, where can you go for that information if you can't hire a travel advisor?
Yeah, the State Department is doing a really great job, and that's the State Department's travel site, has recommendations and requirements for each of the destinations internationally. Locally, you're going to have to visit each destination's local tourism websites or health department websites to get that information. And that's where it starts to get complicated. So you really do have to stay very aware of that, because things are really changing very rapidly. And for most part, on a positive side. I think one of the things to keep in mind, too, though, is that if you are going to be booking travel, you're still going to be faced with a lot of occupancy limits and things like that. So you're going to want to be very careful about booking your travel early, being aware of what cancellation requirements there are and things like that.
Should you also consider travel insurance, the things being so fluid?
Absolutely. But definitely read the fine print. A lot of travel insurance still have clauses around the COVID-19. Some are covering, some have changed that. But you definitely want to read that fine print very carefully and make sure you get an insurance that's appropriate for your travel.
Okay, and this question is for both of you. We have less than a minute. For people who say, you know what, I'm going to hold off. I'll wait until 2022 to schedule a trip. Any recommendations for those folks?
I mean, I think those are definitely the CDC recommendations, is to stay home and be safe. And I think the key is find a fun way to break up the routine of the day to day. And I think especially if you're a parent and you have young children, how can you make maybe your local area where you live more interesting, more fun, getting outside, getting in nature? These are the things I think that are really, really critical after the year we've had and after the winter many places around the country have had.
Okay.
Yeah, and my recommendation would be if you have the opportunity to get vaccinated, please do it. One of the things that we are going to see is there's likely going to be restrictions on travel and limited to people who are only vaccinated. We're definitely seeing that as a possibility in things like the cruise industry. Some of the airlines are actually considering that as well. So that's definitely something I would strongly recommend. And just on a really funny note, not too funny, but please check your expiration on your passports. Many folks put those away for the last year. They're going to pull them out and find that they are expiring or soon expiring. And it's going to be a real rush to try to get those renewed.
I know that for myself. I just got mine renewed last year, and it took 7 months. So there were some backlog issues with that, too. So thank you so much. This was great information, Dr. Taz and Troy. It's been a pleasure.
Thank you.
Thank you.